Just starting off, firstly, we've currently got 20 active cases in Victoria, one new locally acquired case, which I'll speak to in a moment. We've got 11,359 tests that were received yesterday, and I want to thank all those Victorians who came out yesterday so strongly to be tested, and how important that is to keep on top of these outbreaks. It's such an important role that Victorians play. I will have, after I've spoken just a bit about the hotel quarantine case, Martin Foley will take you through just in terms of where we're up to with testing for the Grand Hyatt case, and also exposure sites, and Jerome will also go through testing arrangements for the day. So as people are aware, we have a hotel quarantine worker from the Holiday Inn, not the Health Hotel Holiday Inn, but the Holiday Inn at the airport that has tested positive yesterday. This person is an authorised officer. So an authorised officer doesn't sit on the floors like our RSOs or our police do in health hotels, but is responsible for issuing the detention notices to people when they arrive from internationally and come into the hotel, as well as if there are changes in their detention orders, or they're being moved to a health hotel, or they're being exited from the program. So that's their key role, is to provide the legal framework for the detention and also the exit. Now, in relation to this particular case, the person tested negative. There were two nasal swabs on the Wednesday and Thursday, the 3rd and the 4th of February. They were negative results. They then had Friday and Saturday off, the 5th and the 6th, and then came to work yesterday, was not symptomatic. Later, just after, and had a test obviously as they worked that day, later became symptomatic about an hour after finishing work, and the test came back last night showing that this person was positive. At this stage, when we've had a look through this person's engagement with people as they enter the hotel, as they exit the hotel, as they get moved to health hotels, it appears that there's no breach in that engagement in terms of how close they were, in terms of touching things, in terms of not using infection prevention and control. So we will need to wait for genomics. We'll obviously continue to interview, as the Health Department are and CQV are, interview this individual about their activities and see whether there's any other memory they have. We're obviously also checking rosters and checking her movement through the hotel, whether there was any engagement with anyone who was positive. But at this stage, again, it doesn't appear to be any breaches of infection prevention control procedures that are shown in their engagement with anyone who has entered or exited the hotel at any point. I would say that, one of the positives, she's obviously been very cooperative, as we saw with the Grand Hyatt worker. She's also been wearing masks as required, which is also, I think, an important protection for those who have attended particular exposure sites. Doesn't mean they shouldn't get tested, but it's certainly an important protection. We currently have about 80 CQV and hotel staff that are stood down or in isolation and having to be tested, and in isolation for 14 days from the time of potential exposure. We have 9 police who are in that position and 12 ADF who are also in that position from the Holiday Inn. Again, it's a matter that we'll need to continue to investigate, as I indicated on the weekend. However, we continue to make changes to the program as these cases have come to light. For example, I spoke about the review we're doing into air conditioning. Of course, we're still pretty confident about the engineering reports that show that there's no sharing of air between rooms or into common areas, but again, we've got our occupational physician who's coming in with the engineering team to have a look to see if there's anything else with air conditioning or any risk there. We've implemented the staggering of meal deliveries and other deliveries to individual doors. We've also put in place the face shields with the surgical masks for all staff. Some still wear N95s when they're dealing with infectious people, and we've also got the rooms that are buffered. We'll also start today the testing of staff on their days off. That will commence from today. So all these changes are about continuing to make the necessary adjustments to the program as new evidence comes to light, as we see different sorts of transmission occurring in our program. So our key aim here is to not just have a robust hotel quarantine program, but a robust outbreak management team and contact tracing system. I think we're seeing those. We've seen that with the Grand Hyatt, and we're seeing it again with this case. They moved very quickly last night when that positive case came in late last evening. So again, the message to Victorians is that we have built a system, that combined system that's about reducing the risk of large community transmission in Victoria. And the restrictions that we have in place have probably also assisted during this particular outbreak. So I'll now ask Martin to just provide a bit more detail around exposure sites, the Grand Hyatt, before Jerome, and then we'll take questions.
Thank you. So, as the public health team indicated late last evening, there are currently 3 Tier 1 exposure sites that have been listed. They are a cake shop in Maidstone, Dan Murphy's in Sunshine, and a retail facility at the Water Gardens complex. The specific times and details I'll get Jerome as the commanding tester to go through in terms of encouraging people to visit the expanded testing capacity that is being established in the north and the west as we speak. But we would of course encourage any Victorian, not just in those parts of Melbourne, but right across the state with even the slightest of symptoms to come forward. It's the most important thing you can do to protect yourself, to protect your family, and to protect all Victorians is to get tested even with the most slight of symptoms. I can advise that as a result of the Holiday Inn authorised officer working with the public health team, that at this point we have rapidly identified an initial 15 social and household primary close contacts. That number may well fluctuate as the investigation continues over the course of the day, and of course those people are all isolating and have been tested. As the Minister has also touched on, the CQV staff and related group of workers who have been isolated and tested in that location, and we would of course expect, as QR codes, as text messages are sent out later today by our public health team to the targeted areas, that the exposure sites, primary close contacts numbers will grow, and that those people will also be required to isolate and to test and to be supported in their 14-day isolation as primary close contacts. But we have, of course, still have to see through the Grand Hyatt case, and I can, in addition to yesterday's most recent update, just advise people that since last Wednesday evening, or really since last Thursday, when the response to that outbreak commenced, we've now seen 61,359 tests as of midnight last night being undertaken there, and all of those have returned negative, and we have now well over 1,000 people doing the right thing, being as primary close contacts, being isolating for their 14 days from their most recent exposure at their home. That includes, as I indicated yesterday, the CQV Grand Hyatt workforce number fluctuates as more details comes to pass and further investigation of rosters, availability, when people worked, and what they were doing. That figure has been revised at the primary close workplace contacts for the Grand Hyatt to 661 people. And in terms of the exposure sites, the 14 exposure sites that are listed in the southern and southeastern suburbs, that figure has been revised up to 584 primary close contacts. And as we indicated yesterday, we're still at 21 for the household and social primary close contacts. Add all that together, that's 1,266 primary close contacts associated with the Grand Hyatt case. Those people continue to be isolating for their 14 days, and all of the results that have come in, now over 80% of that figure, all the results that have come in for that group continue to be negative. And of course, that particular case, together with this case, gets that three-ring approach of support for the person with the infection, support through their primary and social contacts, and then indeed the secondary contacts. So we will continue to apply that approach in the now Holiday Inn case, and I'll ask the Commander of Testing to go through some of the more detailed responses to that particular case.
Thank you, Minister. Good morning. Late yesterday evening, we deployed again our rapid and comprehensive outbreak response to the latest or to the new case of the hotel quarantine worker who was tested positive yesterday afternoon. What I can confirm is that we now, early this morning, we mobilised some of our testing sites early at 7:30, and of course, late last night, our contact teams started tracing already. I'm pleased to say that as we stand here only a few hours in, we already have over 100 people who have been asked to isolate for 14 days and to be tested, and of course, we have our full testing teams up and running in the northwest this morning. In terms of some of the details, there are 3 exposure sites that we currently have listed. Of course, conversations continue with the positive case, but we are very comfortable and very glad of the information she's provided with us and the good record that she's kept of her movements. The exposure sites of particular concern to us, and I would ask anybody who has had who has been to these contact sites during the times I'm about to indicate, to please come forward and get tested today, and I'll give you some details about where you can do that. The 3 key contact sites for us at the moment are Marciano's Capes at Maidstone. That is on the 5th of February between 9:45 and 10:25 in the morning. The second exposure site is Dan Murphy's at Sunshine on the 5th of February at 10 to 6 in the evening to about 6:30 in the evening on the 5th, as well as again the evening of the 6th of February, again Dan Murphy's again on the 6th of February between 10 to 7 and 7:30. And our third and final exposure site at this point in time is the Off Your Tree Water Gardens, and that's in Taylor. It's a clothing store in Taylor's Lakes, and that's on the 6th of February from around 1:15 in the afternoon until 10 to 2 in the afternoon. So that is the initial set of exposure sites, and again we will update these during the course of the day as we have of course done with all of our recent outbreaks. Of course, the contact tracing team is now working both with the case with around 15 personal close contacts and around 80 or 90 workplace close contacts. I would expect those numbers to move around a bit over the next 24-48 hours, and of course we'll keep people posted. We have, of course, surged our testing capability in response to this. You'll recall on Wednesday, Thursday last week, we surged in the southeast. It's now, of course, a turn for the northwest to see a surge in testing activity. In particular, we've got 3 of our 3 large testing sites at the Shorten Reserve in West Footscray, at Victoria University in St Albans. Both of those are open till 8 p.m. tonight. We've also doubled the capacity at the Showgrounds testing site at Flemington. And that'll be running later on this afternoon into the evening, again with 4 lanes, giving us more capacity in that area. We've also stepped up capacity in the city, so at MSAC and at Montague Street, both in the southern end of the city. They're open till 8 p.m. tonight. And we're expanding our testing capacity at Sunshine Hospital, at the Sunbury Respiratory Clinic, and at the community health facilities at West Sunshine and at Deer Park. My thanks, of course, to the now huge team of people in our health services and community health for mobilising late on a Sunday evening to start opening at 7:30 in some cases. And again, we'll have a couple of very long days ahead of us as we encourage people to come out. And it's critical at this point, as we've seen again with these outbreaks, it's the early, fast movement that makes a difference. We saw a fantastic response in the southeast on Thursday and Friday with good testing numbers coming through. I'd really encourage anybody, particularly in the northwest of the city, if you have any concerns about your health, if you've been to those exposure sites that I've gone through, we need you to come forward and get tested today. If you've been to those exposure sites, we need you to isolate for 14 days. Please contact us. We'll give you our full support to enable you to go and do so. The same, of course, rapid response is serving us well with the Grand Hyatt outbreak from last week. We're pleased to see over 80% of the over 1,200 close contacts have now returned a negative test result. We will continue our focus on the Grand Hyatt outbreak, and of course this is the benefit of having such a strong and widespread team of contact tracing capability across multiple public health units, both in the southeast of the city and the northwest. My thanks to the entire public health teams for working so hard and so diligently to provide this response. This is all part of our response here in Victoria, so how we maintain our COVID normal. We ensure we can get around after these outbreaks very quickly and run them to ground, and we're very grateful for all the support we're getting from people to enable us to do just that. And with that, we will take any questions.
How old a worker has a more infectious strain?
Sorry. So genomics testing is underway, and we expect to have results on that probably late tomorrow or the following day.
Are you working on the assumption that they might?
Yeah, so we always take an abundance of caution on our approach. So we're working on a worst case scenario that says we're dealing with a complex strain. We do not know that yet, but that's why we're deploying so swiftly, and that's why we've got these resources going in.
Are you looking at aerosol transmission?
So I'll leave others to speak about the speculation on the individual events, but as I've said, we are working on the basis of that we've got we'll take a worst case scenario, so we'll ensure that from the point of view of our reach out to the community, we want anybody who's been in remotest contact with these exposure sites, all the primary close contacts to come forward and get tested, and we'll continue to work that.
Last week, Alan said that it worked to use days off. Has that started happening?
Yeah, so I'll ask the Minister to comment on the details of the CQV programme. I mean, we've done over 102,000 tests now, daily staff tests of the CQV workforce. And of course, that's been in place since the 7th of December. It is that consistent daily testing programme that means that in this case, we think this person turned infectious probably yesterday or the day before. So we have a very short period now to chase around after. That was the whole principle of our response to dealing with the risks around hotel quarantine, and that is why we're in a strong position to start today. That we are now offering, or we're now providing off-cycle testing for people who are not working those days, and the Minister will provide more details if that's all.
The Minister said that begins today. Why hasn't it begun earlier?
So, as we've said over the last few days, we've initiated that programme. We are, I believe, the only state at the moment that provides daily testing or every shift testing of all the workforce associated with hotel quarantine. We're now stepping that up further to include off-cycle testing.
But if it was said to be daily testing, why was it only for work shift days?
Sorry?
If it was said to be daily testing, why was it only for shift days?
So right from the outset of this programme, we have provided uniquely testing every single shift that people turn up to work, and I think over the last few days we've now extended that programme to also allow for testing on people who are not at work, so people taking 1 or 2 days off. I have to say again, the thousands of people working in the CQV programme are on the very front line, as we discussed yesterday. They are doing the really hard yards, and that is why we have such a strong testing response to support them, and that's why I'm pleased that we've caught this case so quickly, and we can put in our response to make sure we run it to ground.
So when will day off testing be up and running?
Is there a possibility that we might have contracted the virus in the end? Is this prevalent to the other regional?
So, look, of course, our contact tracing approach looks at all options, so we don't close our mind to any possibility. We've had extensive conversations last night with a positive case with our public health teams. They provided very good information. Our lead assumption at the moment is that there's been some connection back to hotel quarantine because that's the largest risk that this individual faces. At this point in time, her movements around the community have been relatively modest, so not many exposure sites, not much movement outside the house. We will continue to explore any other possibility, but at this moment in time, our lead assumption is that it's somewhere in the hotel quarantine program.
Can we just get some idea of...
When will day off testing start?
I'll leave for the Minister to comment on that.
How many known cases are in the Holiday Inn at the moment, or have been during the last fortnight?
I don't have that information with me at the moment.
Can we get some idea about how she might have picked up? And I think the Minister was talking about the CCTV. Like, has she had absolutely no interaction with visitors? Can you give us some idea? Because obviously it points to the aerosol. Just whatever is or is not on the CCTV.
So look, we're going through it again in all detail every day. I mean, obviously it's most likely to be the 3rd or the 4th, given she's only positive on the 7th. But people deal with people exiting through perspex screens, all of those things. So at this stage, so it's not like they don't have contact, but they have full PPE. So the issue is, have they complied at this stage? Yes. So
and she hasn't been up on the floors. She's only been in the entrance.
So at this, what hasn't been where on those days where we've had positive. Now we're continuing to discuss that with her, look at what she's been doing. So the next couple of days will be critical, but the genomics particularly will show, is there a particular individual case that it's linked with? Is it a direct contact or not, or is it a intermediary, which is what we had with the Grand Hyatt?
And just Rachel's question, like, how many positives in that hotel around those days?
Well, around those days we moved about 3 people who were positive, and they were a family, and they get moved to the health hotel. And at this stage, it's not clear that she's had a dealing with these 3. But again, we want to keep doing the interviews.
But there's no video of her with that family at the moment.
As the authorised
not dealing or breaking any protocols.
Sure.
Yeah.
As the authorised officer, wouldn't she deal with everyone who's arriving and leaving?
There are a number of authorised officers who are on duty at any one time. Yeah, but there are a number on her shift at any one time. So
when will off-duty testing commence? Will that?
Yeah, so that will we will commence it today. So just if everyone, firstly, the public health advice was test during shifts. Now, don't forget, people on their days off, once you ask them to test, that becomes a work day. So this will be asking people to do pretty much 7 days a week, whether they're on duty or off duty, doing some work. So are there issues we have to work through for those workforce? Absolutely. So in their contract, they are required to do the on-duty testing. We are now working through those issues. We will commence that program today. Again, the public health advice when we established the program was to do it on work days. No one else is doing this. We are now doing. We will go over and above what the public health advice was in order to again reduce any risk to community transmission.
And does that mean you have to recontract everyone?
Well, we're working through those issues. We hope that that's not the case, and we're looking at how, we will hope that everyone who's in CQV program will have a card. They'll be fast-tracked through testing so that when on their days off they can get through quickly, so they're not waiting around for hours for that
So
testing.
does that mean they have to be paid for the full day?
So we're having to look at those issues as well in terms of, is there some sort of allowance? That's right. Does it have a leave implication? So again, not many people are asked to work on their days off in jobs like this, and that's exactly what we'll be requiring from today.
And are you trying to make it mandatory, or will it be voluntary?
We're commencing voluntary today, but the intention will be to make it mandatory.
When do you see
Are you
that
looking
being?
at aerosol transmission?
Sorry.
So look, I think it's really still too early to say that. There's again no evidence of, in the case that we had at the Park Royal where a door was opened and there was a viral load and looks like aerosol spread. Until we get the genomics, it really is too early to be able to make a guess. But as I said, as I spoke about on the weekend, we are doing the review of air conditioning regardless. We've changed already the people wearing face shields. That was on infection prevention control. That commenced on Thursday. The meal deliveries have changed. So we've done all those changes that we know potentially might help us with aerosol spread. But again, too early to say in this particular case. So I'm not sure if Jerome, no, but I think my memory this morning, we had a cabinet committee meeting this morning, was that it was a high load, yeah.
So
but
that's
again, it's
the family of
unlikely
three or
to
her?
have been. It's likely that because she only became symptomatic yesterday, after her test yesterday, that it's probably only one day where she's probably been infectious.
Raf's question is it the family three that have a high viral load as well, or just
We don't. Their genomics aren't back, and we'll have to have a look at that.
So when do you anticipate to make that off-duty testing mandatory?
We would hope to get by the end of the week to be in that position.
And is there any thought, I don't think any other states had 2 workers pick it up within a week. Is there any thought to pause and, I know you review all the time, but That's unusual, right? 2 people in a week. Is there any rethinking of the actual program?
Oh, well, you know, as I've just gone through, we're changing the program all the time. Like, I still believe we have, you know, we've got police, we've got ADF, we've got testing of every worker, we've got we've got the best infection prevention control people working for our program now. You know, people who worked on Ebola, thousands of years of experience, so we've got the best of those procedures in place. You know, I think there is an element in which this is a changing virus, and I think what we've seen this week, and the other states have recently as well, we've seen in the last week that this virus is more contagious, it's moving differently, it's lasting longer, which we've seen in New South Wales just this weekend as well, 16 days after being out of quarantine. So this means we have to constantly review our program. That's what we're doing.
But you're going to keep having a program, like you're not thinking of stopping it?
No, look, at this stage we'll continue, but of course we, you know, again, how we step that program up will very much depend on the outcomes of these cases and when it's safe to do so. So, you know, we've got a number of staff who are currently stood down, quarantining, so that's taken out, it's almost about 950 staff now that are out of the program for 14 days from the time of exposure, and we're also reviewing the air conditioning. If there's anything in that needs changing, that may slow the ramp up of the program.
Are you considering extending it past 14 days? And you
Look, I might get Martin to speak to that. You know, we're in conversations with Public Health about what's happening in New South Wales. So, anything else for me before
it's now actually 3 cases in 5 days. We include the guests across the corridor. That we haven't seen that in other states.
Well,
does that indicate that there is something about quarantine in Victoria that isn't good?
So firstly, let's look at the Park Royal case. They're positive cases. We have positive cases every single day in hotel quarantine, and they're moved to health hotels every single day. In that particular case, it is clear that it was people opening their door together. That's what it now appears to be. That's what Alan Cheng has, the Deputy Chief Health Officer, has indicated. They open their door at the same time for seconds, and I think they all do that. I think what it is indicative of is that this virus, the strains that are coming from the UK and South Africa are different and are moving and being responding differently, and people are responding. You know, interestingly about the Park Royal case, the husband didn't get it in the same room. So you know, some of this is hard to predict about how this virus will interact with you. I think the Park Royal case is very different. We have a lot of we have people every single day in hotel quarantine who are positive. Yeah, so look, we'll be doing that review. There are 2 factors. One is when some of those staff come back. Some of them are coming up to their 14 days because it was from the time of exposure. So we're in that process of looking at our ability to safely stand up. You know, we've got the hotels because they were as a result of the tennis. We've got 2 additional hotels that we can utilise. But you know, if the ventilation review came back and said we needed to make any changes to air conditioning, that would obviously, you know, that would come first before increasing the cap. This stage we are working on the basis that we will increase the cap from next Monday, but I can assure people we will not do that unless it is absolutely safe to do it and we've got the staff and the conditions to do it. Look, I'm not sure. I think if dealing with positives, they wear N95 and a face shield. If they're not dealing with positives, then they're wearing now a face shield and a surgical mask. No, the advice from the Infection Prevention Control team, we have a steering group for CQV, was clearly that to move everyone to N95s was not going to be the best solution, just because of the way they operate and how people use them, that it in fact may be more risky. So the face shield with the surgical for the vast majority, and using N95s and the full PPE for those who are positive was what the advice to us was, and that's what we put in place from Thursday evening.
Was there any discussion this morning when it came to this latest case? There's a large public event getting underway right now. Is there any discussion about whether you should change the protocol?
look, there's been no advice to us about that change. Certainly the advice was that we maintain the restrictions, the additional restrictions we've put in place now, which is wearing of masks, which hopefully has played a big role in this weekend in terms of this individuals' visits to different exposure sites, but also, and the 15 gather at home limits. But at this stage, there is a COVID-safe plan in place for the Australian Open. People have confidence in that plan. At this stage, the Grand Hyatt, there are still negative cases, still a little bit early, so we're not yet seeing any broader community transmission. So, but of course these things continue to be reviewed, and we'll be meeting again later today, and if there's any changes we'll make some announcements to it.
Minister, with almost 1,000 people isolating staff, how many other staff do you have to call upon?
Look, we have, because we increased our staff for the Australian Open, we had, I think it's, sorry, I should ask Emma this question, about 4,000? Just over 3,000 staff. So again,
a third of those people in isolation.
That's right, but some of those will come back in the next couple of days because they were to do with either the Park Royal, and the exposure sites for the Park Royal are now coming up to 14 days isolation, and again negative tests, and again similarly with the Grand Hyatt, the last exposure date means that we're coming up. So many of those will start to come back online this week. So we're doing those assessments. So how many staff will be back on? Are we able to stand it up? We won't stand it up unless we've got the staff and it's safe to do so, and the review of the air conditioning says that we don't need to make any significant changes to the ventilation system. If we need to do any of that, of course we'll review the stand-up on the 15th.
How many staff do you need to have to be able to increase that flight cap?
I think we can, if we get half of those back, we'll be in an okay position.
Have you got enough staff to keep the hotel quarantine system running as it should be this week?
Well, absolutely, we have enough staff. So at the moment, we've been able to utilise the additional staff that were recruited for the Australian Open, who haven't been being utilised, who had been going into the other View and the Pullman Hotel to come in and backfill those positions. Most of them were continuing because they were going to be part of the increase in the cap anyway. So they were already on contract for us to do that. It's just meant that instead of being at the View standing that up at the moment, they're over helping us with the other hotels.
Did the Premier ask for extra army to deal with this increase in extra defence personnel?
Yeah, so through the normal processes, we put in a request for about 460 additional ADF. It's around that figure. They do work that out based on shift numbers, but around 460 additional ADF staff. We were notified during the week that they would accept. They haven't actually notified us of the number that they are sending. Formally, they have not done that. I think they might have done that in the media, but they haven't done that formally to us. They have indicated that they accept some of our request. We had, if people recall, they were not willing to do the floor monitoring in the health hotel last time. We had asked them to do that in the complex care hotel where there is no COVID cases in order to free up some Victoria Police members. They have rejected that part. We thank them for their contribution, whatever that number is. It probably is going to be around 200, but those figures will be negotiated in detail between Emergency Management Victoria and the ADF. But, it was disappointing that they weren't willing to do the floor monitoring. And I just remind people that we have RSOs doing floor monitoring without enforcement powers, and that works very well in the non-health and complex care hotels because Victoria Police are on site to come very quickly.
But the other big pole up there as well, doing the floor monitoring. And if the Army were to accept this job, the big pole would be there to entertain someone if they need to be. Because that's what they're telling us. The Defence Force won't do this job because they don't have powers deputised under the state.
Yeah. So firstly, VicPol are at every hotel, right? So so they're at foyers, they respond, fire escape alarms go off, an RSO rings and says someone's trying to leave their room or someone's having some criminal activity. They're there on site every day at every hotel. In the health and complex care hotels, they are also on each floor. And what we had suggested was we understood that they weren't willing to take the COVID risk in the health hotel, that in complex care they could be there, like RSOs are in other hotels. The way the system works. If there's any incident at all, the RSO rings down to police. Police are there in moments. So they don't need enforcement powers, but look, that's the decision that they made. It's disappointing, but we do welcome the additional staff that are coming to do
Why
the
do you think
ingress
there's
and
still?
egress.
Why is there still bickering between you and the federal government about the army?
Oh, well, I don't know that there's bickering. We have a different opinion about. We wanted them to help with ingress and egress. They're doing that. They've agreed to do that. We've also had hope that we could offset some Victoria Police member numbers because they're quite intensive, large numbers in health and complex care. They've said no. We're disappointed, but we're working together, and on the ground, the ADF and VicPol and our CQV staff work very closely together.
But they're on the radio this morning saying actually Victoria's got more help than any other state in response to the Health Minister yesterday. That's bickering, isn't
they have certainly provided great assistance. I think that number was particularly in relation to bushfires because we didn't utilise the ADF of people, remember, in the first part of hotel quarantine. So, and we really appreciate it. And they did it, I saw them in action. I spent time out in bushfire regions. They did an amazing job. So this is not about their capacity or capability. We have a bit of a difference about, could they be helping us in a particular area? They haven't agreed to that. I'm expressing disappointment, but also thanks to them for coming on board and the ADF for doing a great job. I think we can be both. We can cooperate as well as have small disagreements.
Having Holiday Inn Hotel, is there CCTV monitoring every aspect of
No, so not every hotel has it on every floor. And there was a question raised at the start of the program about whether we would put CCTV on every floor instead of having floor monitors. The decision was taken based on advice that that would not be a good investment. We needed people on the floor so that if anyone had a health issue, and that's not uncommon, it's pretty common, and people end up in hospital quite regularly. Health issue, behaviour issue, they try and leave their room. We needed people on the floor. That's where we've invested additional RSOs or police in the case of the two other hotels. So the CCTV footage, some of it is on floors. Most people go to a hotel not expecting to be watched every step of the way, so not all of them come with CCTV on each floor. Now, Queensland have, I think the review has indicated they should have, but I don't think they have someone on every floor either. So it's for a different reason they're recommending it. The reason to put CCTV on every floor would be more to investigate cases, and that's what we've got to weigh up about. Will that be, how helpful that will be? It isn't about protecting people on the floors or people in the hotels, because we believe the RSO system and the VicPol system on the floors is a much safer system.
Can you explain how important the CCTV will be during the investigation process? Do you think it will be useful to add, obviously the floor monitors with CCTV for investigative purposes?
Look, again, it's a bit early to say. It's possible. Again, this may not be anything to do. So, for example, it was useful in Park Royal. We were able to watch everything, and ultimately, I think it was about 2 times those 2 rooms opened the door exactly at the same time, right? So ultimately, when we went through everything again and again, so it was useful there. And look, it may be that and we are actively looking at that issue. I think there are other investments, the aircon, all of those things that we needed to act on very quickly because they will probably add greater issue. But just so we're clear, the issue of CCTV is not about having people monitoring people on the floors. They're actual people need to do that. CCTV may be helpful for investigations, and we'll look at it from that context.
You're currently testing hotel quarantine residents on day 3 and day 11. Is it possible that this worker has caught the virus in a case you don't know about yet?
Well, don't forget they're negative right up until the 4th of February. So it's possible. So it is possible. And look, it's one of the things that we're also looking at is whether, because of the number of people who are asymptomatic, so at the moment we test everyone on day 0 if they're symptomatic. So we're now looking at, do we need to be testing people on day 0 as they arrive? And I think that's a worthwhile and we're seeking public health advice about that, because I think day 0 may help us weed out asymptomatic, get them out more quickly into a health hotel, and that could be a positive outcome as well.
Have there been any further or deeper results yet from the genomic sequencing from the Grand Hyatt that might show something more specific about that transmission?
So my memory of it is that there's no clear link. So it's not an identical link to someone, unlike Park Royal. So it appears that there's an intermediary in between, which could be a surface.
A surface. That's not.
Yeah. And a Deputy Chief Health Officer the other day said that we may never quite know, but it's not a clear link to a individual. So it could be a
Do you know when the HQ workers are going to start getting the vaccine?
Again, can I ask Martin Foley to do, because he's doing all the vaccination work. You want anything else for me?
Yes. One for you. What time did you first learn this case last night?
Yeah, so I got an initial text which was very brief at 7:30 last night, telling me that there was a positive, that there was going to be an outbreak management team at 9 o'clock. I then received more information about 10:30, which had gone through who it was, what had happened, or as much as we knew at that time. A decision was taken that we probably should put out a statement rather than stand up at, probably at that point would have been 11:30, and to do in more detail this morning.
So you're happy with the timeline, and from when you knew to when the public knew, it was almost 4.5 hours in the.
Well, I don't know that we didn't know what we were telling the public at that stage. So at 7:30, all we knew was that a positive case had come back, and that was pretty quick to me. And then they had to actually go. They started interviewing the positive when they first found her, and to get the exposure site. So I think in effect it was much shorter than that by the time we actually had something to tell the public.
Can you explain which quarantine hotels are cohorting their workforces?
Sorry.
Can you explain which quarantine hotels are cohorting their workforces and how that's being?
Yeah, so at the moment we've got cohorting them.
Yeah.
Do you mean at the moment isolating, or?
No, you were talking at the start about cohorting workforces without quarantine program.
Well, okay, so you only work at one hotel, you work in bubbles, so you one group of staff hang out together, whether they eat together, they use only one toilet together.
That's generally happening.
That's right, across all of them, yeah.
And with the ADF, can I just ask, were you hoping that those Victoria police officers who are currently performing floor duties could be back in the community doing regular police duties, or was that to help the hotel quarantine?
No, so with the scale up, the planned scale up, ultimately we'll end up having nearly 1,100 police involved, and we were just hoping to free up a few of those to go back into the community. But, as the Chief Commissioner and I have discussed many times, there's probably no more important role for them to be playing as well. So that's not going to happen, and those police will, are rightly placed in hotel quarantine and in those health hotels and complex care and all the other ones.
The ADF statement, by the way, mentioned 22 hotels. Is that what you're planning?
No.
When you're up to 2,100?
No, about 18 would be ultimately if we get to the 2,100.
All CBD? Do you have those hotels yet?
No, we're requiring those because it's a stepped up process. So we've got the 2 for the next stage, and then we're working through other hotels. So just a couple of comments on, I suppose, CBD, and I understand the issue around remote, etc. Regardless of where we are, we have staff who work in and live in communities, so we're always going to have people interacting. But what I've learnt very clearly, and what the Board of Inquiry told us, we need to be near health services. We have many regularly every single day, somebody who is transported to the Alfred Hospital for heart, for mental health issues, so you absolutely need to be near a hospital to ensure the right care is provided to people in our care. So it's not as simple as being in the middle of nowhere. You actually do need to be near a health a really good health system to be able to support people in your care, not just for the COVID issues, but for those.
With the ADF and floor monitoring, are they doing that in any other state?
No, because in every other state they're using private security. We're using Victoria Police and RSOs. So again, we weren't seeking them to take the RSO's role. It was more about freeing up Victoria Police members.
But you're asking them to do something they have not.
Yeah, we did, and we were conscious of that, and we took them through and we showed them how we operate, how it would work with VicPol. They spent a lot of time with VicPol. Again, they've made a decision, disappointing, but they've made that decision, and Victoria Police have been prepared anyway for the increase in the numbers they're going to need.
Just to Bridget's question earlier, can we clarify that are you saying this worker hasn't worked in any other quarantine hotel as well?
No, they haven't. So people work in one hotel. That's it.
Experts have predicted that, there will probably be pandemics long into the future, specifically with this virus, for the next 18 months, possibly even with the vaccine. Do you think it's time for the Melbourne government to build dedicated quarantine facilities
Look, I know it's something that First Ministers, including the Premier, have raised about, and again, as I said, it can't be sort of in the middle of nowhere. I don't think it needs to be somewhere where you can provide health services. Look, we've always said that we see this as a partnership with the Commonwealth. They have a role to play, we have a role to play. Workforces, all of that are often state work-based workforces. We're open to working with the Commonwealth on the model. I think I heard Jane Holton today, it is about that national best practice. This is a virus, if it gets out in one state, potentially gets into another state, so it's not just a Victorian hotel quarantine program or New South Wales, it's a national program in that sense. So being able to make sure we've got the right program in place and everyone is working at the highest possible standards is good for all Australians and good for Victorians.
What needs to be done to make sure people don't travel to Australia with the virus, like a pre-quarantine and a negative test or something like that, given we've got the hard more and harder to Australia?
Well, look, I will leave that to the Commonwealth because those are their rules. Around pre-testing, that is not something that they're required to do. But again, look, people can test negative, as we're seeing, and be positive on the plane. So it's not a guarantee that you're not going to get it. Is there value in people getting tested before? Potentially, but we also know some countries don't do testing very well, or you couldn't necessarily have that confidence. So you still have to have a system like this that assumes that everyone who comes in is positive.
Instead of scaling up, to maybe scale it back down just because of the highly infectious variants.
So I think I sort of addressed this before. At the moment we're running our program, we're aiming to uplift it on Monday, but the issue of staffing, air conditioning, what we're seeing now will influence our decision on that. We haven't made a decision to not scale up yet, and we haven't got a decision to scale down. But look, this is, we can all say that we take no Australians back. That would be what we're saying, is that no Australian people should return. Now, some people might support that. At this stage, we've all signed up to bringing Australians back where we can. We're doing it in a balanced way. We're not as high as New South Wales, and we won't get to New South Wales because of our model. We will do it as safety will drive us, infection prevention will drive us, the system will drive us. But at this stage, Australians, we are trying to safely get as many Australians back home as we possibly can. Sure.
I was going to say, can we notify this vaccinating return travellers as an extra precaution?
Yeah, well, let's see if that's a conversation they're doing.
So a few vaccination questions there.
Return travellers coming into hotel quarantine, could they be in line to get the jab earlier as an extra precaution?
Well, as you know, vaccinations is led by the Commonwealth. The Prime Minister last week at the National Press Club set out the timeframes and the arrangements. Those are matters for the Commonwealth, particularly returning travellers and borders issues for the Commonwealth.
So do you extend hotel quarantine past 14 days if obviously days?
This issue came up over the weekend, and from conversations that we've had with other jurisdictions and through the public health teams around the country, my understanding is that those matters, particularly in light of a New Zealand case last week, and as I'm advised, a New South Wales case over the weekend, that's through AHPPC and its working groups, they're looking to how to operationalise that very thing.
So are we doing that here, looking at extending it all here in our
Well,
quarantine?
we're working through all of those issues with our public health teams. As we indicated yesterday, we're in close cooperation and consultation with those interstate jurisdictions, because of course people are released from hotel quarantine and they go home. They might not be in Melbourne, they might live in Melbourne, but they might be released from Sydney. So we've got to make sure that all the jurisdictions are cooperating in this, and that's exactly what we're doing.
The Federal Defence Minister has said the fact that you didn't know that ADF were turning up yesterday shows there's issues.
But they didn't turn up yesterday.
Last night. Last night people turned up.
So
are there issues with communication with the Victorian government?
not at all.
Can I just jump in on that?
Sorry, can I just get...
By all means.
Can I have...
Okay.
Not at all. Hotel quarantine and the ADF work through the Department of Justice. I'm the Minister responsible for the Department of Health. Hotel quarantine, and therefore the contribution of the ADF, is done through the Department of Justice and CQV. So there would be no need to brief them. Those matters come back to Cabinet in the normal processes of reporting, and that's precisely what's happened in this and every other example.
So we've still got ministers and departments and agencies not talking to each other.
That's a particularly unique interpretation of what I've just said. There are reporting processes that go through the Cabinet process that get back to all ministers. So that's simply not correct.
Do you know when the hotel quarantine workers are going to get vaccinated, and do you know what vaccine they're getting?
So we know that as soon as the Commonwealth makes available to us the Pfizer vaccine, that will be made available to, we hope, 9 hubs that we announced last week. We've said, indeed every state has said, that public health advice is the best thing we can do to respond to the COVID incursions into our nation is to vaccinate our frontline hotel quarantine workers first. That's the position of all the states, and as soon as we get our Pfizer vaccine from the Commonwealth, that's what we'll be doing.
Do you know if that's this month?
The Commonwealth advises us that will be late February, early March.
Are you concerned at all by reports that South Africa is suspending their rollout of the AstraZeneca vaccine?
I take all my advice on vaccinations from the AHPPC vaccination group, which is co-chaired by Victoria's Deputy Chief Health Officer Alan Cheng, and all our advice on the efficacy and the rollout of all of those things comes through that process. But I do restate, the AstraZeneca vaccine is still subject to TGA approval. We've only had the Pfizer vaccine approved by the TGA, and that's because Australia has a rigorous, amongst the world's best systems to make sure that all of our vaccines are safe and are used fit for purpose. And I'm sure that when those vaccines start to roll out, they will be fit for purpose, and they will be very important in making sure that we reduce this pandemic to zero as quickly as we can.
Professor Cheng hasn't raised any concerns given what's happening in South Africa?
We get regular reports through the vaccination program. That issue is currently before the TGA. These are matters for the Commonwealth to determine. Once the Commonwealth, as I'm sure they will, say that the vaccines are safe and go through their rigorous quality control process, and once the Commonwealth receive those vaccines and once the Commonwealth make those available to the states, we'll distribute them in accordance with the National Cabinet processes.
Just on the third ring approach to contact tracing, do you have numbers on how many secondary close contacts there are, and are those people also required to isolate for 14 days appointment?
So I think I released some secondary close contact figures for the Grand Hyatt yesterday. For the case from last night, we're working through those, and I'll make sure that in any Chief Health Officer advice that those details are made available.
And those people do need to quarantine for 14 days?
So of course the secondary close contact system is you have to work on that basis unless the information of the potential chain of transmission to you through the primary close contact returns a negative test. So if the primary close contact, that is the intermediary between you and the person with the infection, returns a negative case, your chain of transmission is broken and you are free to go.
And of those primary contacts, are they all from Melbourne? Some of them from Victorian, are they like spread across?
I don't have that detailed information as to their locations, but my understanding is they're Melbournians.
Do you have an age, sorry, for that worker that tested positive?
Do we have
Do you have
early
an age?
50s? Early 50s.
Early 50s.
All good. Lots to do. Thank you for your time, and we'll see you soon.
Thanks.